How to fix jowls. With jowl appearing on your face, the drop under the jawline adds 10 to 15 years to your face, and certainly nobody likes them. Today I'll talk about how jowls are formed, what are the factors that are causing the forming of jowls, so that you understand which factor is contributing to your jowl formation, and you can choose various treatments that are available to fix the jowls. Hello, I'm Dr. Geeta Grewal. I'm a trained cosmetic surgeon and founder of Muses Wellness Clinic and 9M Skincare. My passion is to make you look beautiful, youthful, and glowing. Let's understand how the jowl happens. So it's because of laxity in the skin. Number one, that is loss of collagen, elastin. Reason could be a weight loss. Reason could be your genetic makeup is such that when you lose a little bit of weight, you start developing jowls. There is fat deposition in the jowls. There is lymphatic congestion that is happening in this area that is contributing to jowl formation. Or there could be excessive muscle activity in the DAO, which is right in front, and there is shrinking of the fat pockets, superficial fat pockets that are here. So this bulkiness starts standing out very evidently. Excess muscle activity in the pre-jowl area causes loss of fat in this area and shrinking and constriction in this area. And also excess latissimal muscle activity, which starts pulling the gravitational aging so that the jowl dips down to your jawline border. These all contribute in formation of jowl. Lymphatic congestion, fat deposition, fat loss, excessive muscle activity, sagging of skin, loosening of ligaments, and loss of fat tissues in the lateral part of the face as well as the anterior part of the face. When we are seeing such a complex reasoning for occurrence of jowl, the treatment plan also has to be a little complex, but I will try and simplify it for you. Number one, you must do the facial massage every day. That will help in releasing the congestion in lymphatic if you are prone to lymphatic congestion, also prone to fat deposition in this area. If you do a regular massage, because no matter what treatment you do, whether even if you go for a surgical facelift, you will develop them again if you don't do the facial massage. Facial massages are very, very important, and doing the contouring of your jawline, where I have shared the videos. I'll share the link of the video where I'm teaching how to do the facial massage on the jawline to decrease the lymphatic congestion and fat deposition in this area. You must do it morning and evening with your creams, with your thick creams, and or little bit make your hands wet so that you get a smooth glide and you don't make your skin red and reactionary when you're doing these facial massages. So first and foremost is the facial massage. Next is thread lift. If you have a collagen loss and you have a jowl which is below your jawline, this is not going to get lifted with any of the energy-based devices, be it RF or be it HIFU or whatever heavy intensity treatments that you take. The only treatment that will help in lifting this sagging jowl will be a thread lift. Depending on how big the jowl is, it can be either one thread or two threads or four threads, depends on how big the jowl is and how lax the skin is. But the benefit is that you get an instant mechanical lift and restoration and repositioning of the sagging tissue, and that really pleases the patient. That really gives that instant joy to the patient. So thread lift is one thing which will immediately lift and align the jowls. So first is restoration of this bulk and mechanical lifting. Fat loss in the posterior area and in the anterior area. Usually this fat loss is superficial fat. These are the superficial fat pockets that melt away as we age. Again, it is in your genes that you have melted certain fat pockets way faster, and you've accumulated fat in certain areas of the face. So restoration of these superficial fat pockets, best way to restore is a filler injection. That will not make your face bulky. Let me tell you, a lot of patients think that it will make your face bulky. It will not add bulk to your face, but it will restore the lost superficial fat. When we lose superficial fat, the skin gets darker in those areas as well, because the hydration, the nourishment to the skin decreases. So you must be noticing that this area looks darker or this area looks darker. So when we restore the soft tissue with help of hyaluronic acid fillers in these two areas, it not only aligns the whole zone, makes it a one zone rather than getting a depression here and a jowl hanging here and a depression and a darkening here. It will make the full area reflect light very smoothly as a one reflection without having different shadows on the lower face. So filler is an essential tool if you have fat loss in these two areas. Filler will help in getting the alignment. Next most important treatment comes after the thread lift, mechanical lifting, restoration of fat is Botox. Botox helps to decrease the muscle activity. I told you it can be different reason. Might not be all the reason in everybody, might be just one reason. In a lot of patients we see it's just the hyperactivity of muscle which is doing all the malalignment in the lower face, and just Botox works like magic, gives them sharp jawline, lifts their jowls, and you achieve your goal. So it depends on what is the reason. If it is excessive muscle activity, then Botox does the magic. Botox helps in relaxing these excessive active muscles and restoring the jowl and repositioning the jowl. So Botox can be done in the DAO muscle, which is a flap, a triangular thin muscle in this area, and also in mentalis, which rolls the chin up. So Botox in this area and in the chin and around the chin, and in the neck area, in the platysmal bands and around the jawline, to help in relaxing the platysma, which is pulling the face down and getting the jowling effect, will help in giving a sharp, well-defined jawline if it is because of muscle overactivity. Next important thing that can be done for jowl depends on the fat deposit. If there is excessive fat deposition in this area, then fat melting injections will certainly help in melting that excess fat and removing that excess congestion because of fat and giving that jowling impact. Few injection sessions, normally we space it out once in a week or once in 10 days depending on patient to patient and skin type, but they help in dissolving the fat pocket and they help in restoring the smoothness in the lower jawline. After having your basic treatments for having the realignment of the jawline, which is with help of Botox that works on muscle, thread lift that help in mechanically lifting the tissues, fat melting injection that help in melting the fat, and combining it with a radio frequency that helps in stimulating the lymphatics, decreasing the congestion, lymphatic congestion, you can achieve a sharp, well-defined jawline. I also had a bulky jawline earlier, and I certainly did all these treatments to have the benefit of a well-defined, sharp, chiseled jawline, and these things work very, very well, and they give you absolutely natural looking result and not a done up look at all. If you enjoyed watching this video and you learned something new about jowl treatments, then do share your comment with us. If you want to know something more about what are your challenges, if we missed something you want to tell us on that, then we look forward to your comments. Do like and subscribe to our channel, share it with your friends who love watching such content, and like and show your love. Thank you for watching. Stay safe till we meet again.